Basically, a cath lab is a place where we can do something called a cardiac catheterization. And a cardiac catheterization is when we take long, thin plastic tubes, we actually go up the patient's leg vessels or through other vessels into the body. We go directly into the heart. We can check pressures. We can check the oxygen content of the different chambers of the heart. We can squirt in some contrast or some dye to see where the blood flows, shape of the vessels, is there a problem. We make sure that basically everything intravascular and intracardiac looks good as far as normal values, or even if they have congenital heart disease, then we make sure that everything looks good. If they need to have surgery, what their next stage of surgery should be, different processes like that. And the cardiac cath can be helpful for, again, not only doing certain types of procedures that may take the place of surgery, but also gives us an idea of, okay, what do we have to do with surgery, what's wrong with the heart, what's wrong with the valves, those kind of processes. But the spectrum is very wide. It goes anywhere from newborn baby, very small, 5 or 6 pounds, up to an adult-sized person. The basic equipment with the cath lab is we'll use basically fluoroscopy, or basically real-time X-ray, to look at the catheters that are moving around inside the heart and inside the vessels, and then we take those pictures when we do the angiography. Then we can see those vessels that are pinched down, or we can see those valves that are small or stiff, and we can open those vessels up, open those valves up. That's the basic part. Here at our labs here at Coast Children's Hospital, the child will recover in the recovery room or sedation recovery for about 4 to 6 hours. And usually after that, if it's not a procedure that requires an admission, you usually go home. If there is an admission that requires post-procedure, it's usually just an overnight stay, maybe some tests, some x-rays, maybe an echo will be done the next morning, and after that you're usually discharged to home.